SJ. We're going to start with a few questions. And the first question I have is, where do you go to understand the needs of your community served? And I know many of you are going to say the risk maps, but what else do you bring in other things that you use to understand the needs of the communities that you serve? So SJ, do you want to tell everybody how to use the Menti?
Yes. So you have two ways of joining the Menti. At the very, very top, if you go to menti.com, you can use our code, as well as you can scan our QR code, and it will let you answer that question and it will pop up.
The first Menti always is the longest Menti to get going. And I know many of you actually have just submitted needs assessments. So what did you take? Where did you go for data sources for your needs assessment that went into your application, your THV or your HOPES application? Parent surveys, yay. Community members, focus groups, talking and hearing to the community, love it. Community needs assessments. That is also a great place to go and look. Is somebody else, especially your hospital districts, have already done big, huge needs assessments. They have to do them. And so going and looking at your hospital district's needs assessments. Any other ideas, thoughts, sources of data that you use? Great. Now, one of the things that I would like to point out is like a lot of the work on focus groups and surveys, teacher, childcare centers, parent surveys, this really gets you at understanding the needs of the individuals in your community. The community needs assessments and the data I'm going to talk about today is really going to move things up a little bit and talk about the overall community and the need of the overall community and what they need. I want to say that community need and individual need go hand in hand with each other. But we shouldn't confuse community need with individual need, and we also shouldn't confuse individual need with community need. While they do go hand in hand with each other, and we're going to talk about that a lot more today. So let's go to the next slide. So the first thing I want to talk about is why we developed these risk maps. And the risk maps were originally developed in collaboration with the Department of Protective and Family Services, Department of Family and Protective Services. When FSS was the prevention and early intervention. They wanted something that they could use to make decisions about where funding should go and where the biggest needs were within the state. But we also wanted to make something available to y'all. Not just the individual service providers, but also policymakers within each of the communities, community leaders. For example, we did work with actually some county commissioners around how to use these risk maps for policy and making. The point that we wanted to do with the risk maps is to give some understanding of insight and also to bring people together in a unified understanding of risk within their communities. So this unified understanding that can happen at the policy level and the community level can filter down into the service level of what you guys are doing. So this not only understands the need of a community that you're serving, but it also helps you understand about how to plan for what you need to provide to the people in those communities and the communities that you serve. So one of the things that we also learned doing the risk maps, so we're in the process of our third iteration of the risk mapping. And what is currently online is our second iteration of the risk maps. And I'm sure you guys get this when you look at community-based needs assessments, especially from your hospital district or anyone else, you can absolutely drown in data. There is so much data out there, and it never feels like the right data. It always feels like you're overwhelmed with it, but it never really tells you what you want to know. And so what we wanted to do with the risk maps is back up from that drowning people in data, which is what we did the first time we did this, is we don't want you to drown in data. Instead, we want to give you the data that we see is the important predictors of maltreatment risk in a community. So you'll see on the risk maps that our risk maps only have like 25. I believe we're down to 25 indicators on it. We started off with almost 200. So we know how much this can get overwhelming for communities to somehow take all that information together and distill it into a story. But by taking it and stepping it back, we hope that we've given you enough data to be able to tell another story. So let's go to the next slide. So the other thing that we want to make sure is clear about the risk maps is the risk maps are actually risk. They're not substantiations. They're not the community's maltreatment rate. The department wanted to do this. We wanted to do this. And it turned into a really nice effect, actually. And why we focused only on the risk of maltreatment in the community, not the actual maltreatment rate, is one of the things we learned talking to community providers and talking to policymakers is when we presented people with maltreatment rate, everybody just said, what is DFPS doing? This became the story of this is a story for DFPS. This is a story of what leads to substantiation. It did not become a story of risk. It did not become a story of what is going on in that community that's leading to this. So by stepping back and saying this is the risk, not the rate, we've actually been able to shift that conversation and really focus on what are the risks and resiliency in the community and what can we do to prevent these risks from happening. So that was like one of the more successful things that we've been able to do by moving out of maltreatment rates. So when we go through these maps, it's important to understand that these are not rates of maltreatment. These are just the risk levels that we see in the community. So let's go to the next slide, SJ. So the other thing that we wanted to do is actually back off of individual characteristics and to focus on community characteristics. And a lot of you guys do home visiting. Many of you are McVie funded home visiting programs. And because of that, you have a requirement to be a part of a community coalition, an early childhood coalition. And many of you have very strong community coalitions. I know you well. From our other community coalition work that we've been doing with you all. So you understand that you can't do it alone, but also you understand that there are community characteristics that need to be changed. And in order to do that, you have to engage the entire community. And so that's one of the other shifts in thinking that we wanted to do with the risk maps. It's not just talking about individuals. In fact, we are not talking about individuals at all. What we want to do is we want to talk about the overall community structure and the overall community risk so that we can actually focus on the community effort, what everybody needs to do to help make this community safer. Let's go to the next slide. So again, the community maltreatment risk maps, we are really, really looking at community level. We want to say that this is also built upon the idea and the truth that low risk individuals living in a high risk neighborhood have more risk than a low risk individuals living in a low or moderate risk neighborhood. And there is some evidence to suggest that even serving low risk individuals, if they live in a high risk neighborhood, will do more to help bring up that neighborhood and lower risk than serving low risk individuals in a low risk neighborhood. They need help too. I'm not saying that they're not, but there's an importance of just serving people in a neighborhood. It helps lower the risk in the neighborhood for everyone. Go ahead into the next slide. But at the same time, I'm always trying to be careful with doing this and suggest you guys do, is that community level risk is not individual risk. So the risk that we see in a community doesn't necessarily translate into a family who's sitting in front of you. That when we look at community level risk, we do see issues of safety. We see issues of housing insecurity. We see all sorts of issues that lead to risk in that community. When an individual from that community comes and sits in front of you, those may not be their risks. But they're definitely impacted by the risks in that community. So one of the things I like to say, and I have been saying this for several years, and many of you have also been saying this for several years, is community level intervention and individual level intervention is an and, not an or. And we see this through our early childhood systems building work, that you have to do both. So we're looking at systems change work and individual support. And this is why you need to be in an early childhood coalition. That's my plug for early childhood coalitions. They're important because they can change the systems that lead to the community level risk that we see. All right. So now I want to go to the next slide, which is another Menti. Because it's one thing to understand the needs of the community that you serve, which you guys are doing. Lots of discussions, lots of great working with each other, census data, kids count data, of course, is incredibly important. But what do you do with the data? So SJ, let's go to the next Menti.
You can go ahead and switch it over.
Yeah.
I don't know why I moved it.
It should have been on slide 8. Does your
Yes.
organization?
I'm sorry about that. I don't know why Menti switched it to this one.
Okay. Well, let's put it in the chat, y'all. Technology is awesome. And the question is does your organization or coalition tie strategic goals to your findings in your needs assessment? So you guys all do needs assessments. You're all looking at things. And now I want to ask you is your organization or your coalition tying your strategic goals to your findings in your needs assessment? I know the answer is yes to some of you because I've just talked to you about it. But for everyone else, how do you do this? How do you take your data? Are you taking your data and then moving it into your needs assessment, your strategic goals? So Julie and Safe, I know the answer is yes for you all. Can you guys give an example?
Sure. So we have our needs assessment that we get the information from that, and we come up with impact plans that we base all of our goals for each program on the needs assessment, how we're meeting those needs, and what we can project for the future.
Thank you, Julie. I love that of turning the needs assessment. Your take-home messages from your needs assessment get turned into impact statements. And I mean, that's a beautiful use of data. That leads to using your needs assessment to drive your strategic goals. Alex, I was wondering if you could come off mute and talk about RBA a little bit, because RBA is a results-based accountability in communities. That's a tough one to use, but at the same time, it's like ongoing needs assessment.
Mm-hmm. Yeah, it is tough. And honestly, the primary reason it is tough is because of the data. right? Like having a really, essentially what you do with RBA, results-based accountability, is you start with a population level metric, and then you use that to guide your strategic planning. You know, you bring together the stakeholders that are relevant to, so let's say it's your child abuse and neglect rate in your community, right? You bring together all of the strategic partners that would have any impact on that. And then you go through a process of talking about, you know, different potential interventions for the community, like bringing in home visiting models or whatever to bring that rate down. And then on a regular basis, you go back to the data to figure out if you are actually having an impact, to moving the needle, if you will, right?
Yeah.
And the challenge, I mean, like with the Houston Infant Toddler Coalition, that first 3 years is the backbone for, we really want to do work around developmental promotion. But the only population level metric we have for that are the number of kiddos who receive Medicaid, who've had a developmental screener. And let's face it, you know, from an RBA framework, the intervention or the strategy to impact that would just to get more kids on Medicaid. And it's like, well, that's not our work. HITC is not concerned with getting more kids signed up with Medicaid. We want to really improve the quality of developmental promotion activities. And so, I went on too long, but that's
okay.
that's my little intro to RBA, I guess.
Yeah. Dr. Richardson, you guys are using more than RBA. Could you come off mute and talk a little bit about that? Because you guys just changed all your metrics. I mean, you guys did a deep dive into how to really use those metrics to define the work that you're doing and to define the results.
Yeah,
I was wondering if you could talk a little bit.
I would +1 everything that Alex said with regard to how we use RBA. I think that we've taken it a little bit of a step further in the sense that we're also now using it at the organizational level to be able to develop goals and strategies, and really tying it down also to performance, right? At the community level, our community coalition uses the data really to talk about where their contribution sits. And so as a part of using the RBA framework, once we identify the community level indicators that we're going to be trying to track, we also go down to the level of what strategies are being employed and what community partners are using those strategies. It is an ongoing, it's designed to be an iterative process where you're talking about this constantly. And so we're at the step now where we're pulling together members of the community coalition who are interested in sharing their data at the program level so that we can have kind of the full scope of how what the contribution looks like all the way down to the program.
And Dr. Richardson, and one of the things I love about what you guys are doing is that you have this strategy and you have your needs in your community, and you ask everybody to plug in. And this is something at an individual provider level you all can do as well, because you are going to see a lot of needs that you can't address. But you say, which need am I addressing? Where am I plugging in to help my community improve? And we're going to talk about that in a second. And thank you for teeing that up, Dr. Richardson. I kind of did it for you. And I also want to say, Teresa, Norma, I have seen you guys do this before and I really appreciate it, is also using the risk data and other community metrics that you guys have in your needs assessment and making sure that you're serving those communities. I've seen some great presentations. I believe, Teresa, it's your team that's been doing these presentations of showing a map of everywhere that you've served versus everywhere that has high risk, and recognizing, what do I need to do? What does our organization need to do to make sure that we're serving people in those communities more? And Norma, I've seen the work that you guys have been doing about that as well. It's really great. But this is using these data in a much more than just write out your needs and show FSS. You need to serve people. This is actually taking these data and turning it into something living in your community. And that's what we're going to talk about next. So let's talk about, we're going to move into strategic planning and how to use these data for strategic planning. And for some of you, I know that we're going to be talking to the choir. And for some of you, I hope you guys get more out of this. And so one of the things I like to tell people when they're doing strategic planning, especially at the level of an individual service provider, is making sure that the service that you're providing actually addresses a risk in the community. I have actually seen a few providers who say, this is what I want to do. We're going to be providing this particular service. And then you look at their risks and you're like, but where's the evidence base that that service is going to impact any of these risks? So in home visiting, for example, you have a multitude of home visiting programs to choose from. And those home visiting programs are all not addressing the same risks in your community. Nurse Family Partnership, for example, is going to be addressing a lot of perinatal and prenatal risk in communities, and a lot of risks associated with having late prenatal care or not on-time prenatal care. But if you have a HIPPY program, they're not addressing those risks at all. HIPPY is really addressing other risks associated with different parenting and safety issues. And also readiness, school readiness being the most important thing coming out of HIPPY. So when you're doing parents as teachers, the level of risk that you're addressing is also going to be different. So it's also important to match, making sure that your profile matches the program that you're choosing to do, and who you want to serve in those communities. So what is the need being addressed, and are you directly or indirectly assessing a risk? Like I said, there are a lot of risks in the profile that might negatively impact your work. And so that's also important for coming out with strategic planning. A community I worked with a few years ago, this became like a big thing. There's risks and there's real assets in the community. And one of the assets that they identified in the community was they had an incredibly, I'll never forget it, of showing them this. And they're like, yes, I know exactly these providers. They had really strong childcare, really strong Head Start and childcare in their community. And what they did is made sure that those, they went back to their community and made sure the Head Start and childcare was a part of their overall strategy for doing their home visiting program. And I'm happy to say I've seen risk go down in that community. So this is the recognition that you as an individual provider are providing an individual service, but you're not really doing this alone. That you are doing this in cooperation with everybody in your community. You're making sure that childcare subsidies you're connected with the Workforce Commission with childcare subsidies. Big issue right now. You're making sure you're connected with workforce about job training and job assistance. You're making sure that you are engaged in mental health support in your community, which is also a really big deal right now. Charitable food system, the SNAP, TANF, all of those things. All of those things together work together either through your organization or other organizations to help really build that strategic plan. So let's go to the next slide. And like I said, you are going to be addressing a risk, and doing the needs assessment is part and parcel of you making the decision about what risks your program are going to address. And one of the things that I do tell community organizations, especially ones who are really focused on strategic planning around one particular intervention, or strategic planning around their home visiting model, or that it's important to remember that you're part of the solution, not the solution. this puts you back in the community, that there is a part of that community, a part that you need to provide a solution for, but that connection is not everything. You as an organization are not going to solve the childcare subsidy problem. You as an organization are not necessarily going to solve the problem associated with not enough affordable childcare in your community. But it's important to recognize that you are part of the solution to build up this community. You are part of bringing together and helping refer out so that people are being connected to the correct places that help address the risks in the communities. So one of the things that we're going to be talking about as we go through, we're going to go through a profile together, is where are my community partners when I look at risk in those communities? And you're not going to see it necessarily in the data. A lot of times you're going to see it by knowing your community. So in many situations, we have risk profiles, and those profiles are going to really suggest that maybe you need to partner with like a hospital injury prevention outreach program, or you need to partner. Maybe you have a really strong head start. Like I told you in this one community, they had an incredible head start in early childcare infrastructure, and they partnered with them, and it actually made a difference. It helped them and it helped the early childhood system as well. So you're looking for strengths as well as looking for places where you need to intervene. All right, so let's go to the next one, the next slide. So what we're going to begin doing is we're going to begin, what we're going to do is we're going to walk through a community, and we're going to walk through the zip code 78723. And the reason why we're walking through the zip code is this is the zip code of where I live. So I actually can tell you a little bit about the zip code because this is my zip code. But this is an interesting zip code. You'll see that this is our maltreatment risk maps. I'll make sure if you don't have the link to it, I'll make sure you do have the link to it. Maltreatment risk, we can get risk by county or zip code, and we're looking at infant level risk. And for infant level risk, this is an above average zip code. So 78723 clearly needs some services. And so I want to write a grant to help talk about the story of the zip code, to talk about the services that are needed in the zip code that has above average maltreatment risk. So let's go to the next slide. So we have our thing, and now we're going to go and look at the dashboard associated with this zip code. And so what we see is our first major thing that we're looking at is health and disability within the community. So one of the things that we've seen in our maltreatment risks is having adults receiving disability services. Not that that is a bad thing, they should be, but that tells us something about the community that is actually a risk for the community. We know from lots of literature that having high concentration of families where the father is not named on the birth certificate also imparts risk within that community. And also low breastfeeding rates in the hospital. In here, we see that this community is actually doing pretty well when it comes to all of this. And it's below average. Everything's kind of blue and purple, which is what we want. Yay. It's not on the orange side. So they're really hitting it when it comes to fathers being named on the birth certificate. That's about average. Good rates of breastfeeding and low rates of adults receiving disability benefits. So let's go to the next slide. So this is our next level of risk we're looking at, and this is community level safety. So many of our community level safety metrics are focused on falls. Falls, in case you guys don't know, is the leading cause of emergency department visits for children under the age of 3. So fall related injury tells a lot about the safety within that community. So this community has a lot of falls for children. It also has a lot of transportation related injuries, which When you have a lot of transportation related injuries, immediately my public health brain goes to seat belts and car seats. And we also just see a lot of infant emergency department visits for children. That's a metric I want you to pin in your head. Whenever you see a lot of ED visits for infants, this points to quite a few things within the community. One is lack of provider access, and two is health literacy. Both of those have been shown in the literature to predict the number of infant emergency department visits in the community. The other thing that we see is a large crime, a large assault rate within the community. So there's for teens and adults, we see a comparatively high rate of assaults leading to medical care in this community as well. So there's some safety issues going on in this zip code. So let's go to the next slide. This is a fun thing about the zip code, because with all the safety issues, this low income factor actually is reflective of the affluence within the community as well. And so what we do see is that it's kind of high on teen pregnancy, which is interesting because it's doing well on fathers being named. So we have a lot of teen moms, but a lot of the fathers are stepping up. This has below average WIC utilization, which is interesting considering all the teen moms, the higher rate of teen moms. We see reasonably average adults with health insurance, very high median home value. I tell you that's true, and higher now. Very high medium home value, which tells you the people who are owning homes actually are doing pretty well financially within this community, and also a very high level of adults with college degrees. 65% of the adults living in this zip code actually have college degrees. So let's go to the next slide, which is curious, because now we also have the metrics associated with the number of families who are in poverty in this community, which is also high. It's above average. We have over 30% of the children who live in this zip code are actually in poverty, below the poverty level, which translates into 21% of families who have a child in this community are in poverty, and that also translates into a high SNAP utilization rate. So the other thing that we see is there's also really good 3 and 4-year-old enrollment in daycare, with over almost 70% of the children, 3 and 4-year-olds, who are enrolled in formal daycare. So this is public pre-K, child care centers, and also Head Start. All right. So let me tell you a little bit about this community, because it's mine. So I can tell you. Something to know, there's a very large newish development. It's not finished yet. It's been going on for almost 10 years of this, actually 15 years of this new development. It is a whole new neighborhood sitting in the smack dab in the middle of Austin. It's a whole neighborhood, and it's included in the zip code. The interesting thing is the city owned this land. So the city put a standard that 30% of the homes in this new development have to meet the city's affordability standard, which the city changes based on the median income. There's beautiful green space in this new neighborhood, lots of beautiful green space, a centralized park, and it's really become the hub of the zip code. People walk there all the time. People run through there, take their dogs. There's ice cream man. My kids love it to go there, and also a farmer's market. There are 3 established neighborhoods, other neighborhoods in the zip code that are established. They are historically working class neighborhoods, and 2 have seen major increases in housing costs in the past 15 years They're the ones that are adjacent to this brand new development. Their housing costs have gone up dramatically. There's a major park in these 3 established neighborhoods. There's a major park, very large park. Actually, so this neighborhood has lots of great green space. The zip code has lots of great green space, and a very large city-run swimming pool. There are 3 4-star Texas Rising Star childcare centers. I'm sorry, 3 4-star Texas Rising Star childcare centers. So 3 high quality childcare centers within this neighborhood. There are 4 additional childcare centers that do not take the childcare subsidy. So if you're Texas Rising Star, you should be taking the childcare subsidy. That's part of it, being Texas Rising Star. But there's 4 additional childcare centers who are not taking the subsidy within there. So only 3 in the zip code who take the subsidy. The zip code is the location of the Children's Hospital. It's the location of the Children's Science Museum, which is right next to this big, beautiful new park in this development. There's a YMCA that's adjacent to the zip code, but it's on the other side of a really super busy highway. So it's actually kind of difficult to walk to the YMCA. And there's only 1 non-specialty pediatric provider within the zip code. All right, so that's a lot to take in. A lot to take in. Like I said, I live in this community. So let's talk about like strategic planning for this community, and the needs of this community. So what do you see are the major needs of this community? What thing is still sticking out to you that is needed in this community? And you can put it in the chat if you want, because it may be different things are sticking out to each of you. I will tell you the thing that sticks out to me. Yeah, more pediatricians. Yes, I agree. Oh, networking. Yes. Schools. Yeah, especially schools that are the childcare centers that are taking the subsidy. The thing that sticks out to me is safety. We have the Children's Hospital, and yet we still have this zip code has huge needs around safety. Yes, safe way to access the resources. Absolutely. Absolutely. And yeah, and making sure the resources aren't being centralized in this new neighborhood. So one of the things that we see, what aren't the needs of this community? Yeah, high quality childcare. We do have high quality childcare. We don't need green spaces. Yes, green spaces. We're good on green spaces. This is a community that really cares about its green space. So we don't need any more green spaces. The other thing I want to point out is the community also is, can you go back to slide 12, SJ? Is also one more slide back. When we look at this to the health interventions and the perinatal health interventions, this is also not a community where I would necessarily say we need to flood this community with breastfeeding support or perinatal support, because this community is doing well on a lot of these health metrics and perinatal health metrics. Breastfeeding in the hospital is a huge perinatal health metric. I can make all sorts of things, low birth weight, all sorts of perinatal risks predict breastfeeding in the hospital. So they're doing a great job when it comes to this. So the perinatal health may not be necessarily as important as the early childhood health side of things. So let's go back to the next one. Yeah, go back all the way. So we have a good sense of not needs. We have like assets in the community, right? We have like some childcare that's doing really well, some green spaces. There's centralized places within the community for people to go. We could do better on safe ways to access resources, and safety indicators, networking, and definitely more pediatricians. So let's go to the next slide. So now comes the next question. Are there risks in the profile that might negatively impact your work? So if you're going in and you're doing early childhood work and you want to bring that in, yes, Abigail, thank you, because you know this neighborhood. Safe, Any Baby Can, Easter Seals. Actually, Any Baby Can, Safe's not anymore, but Any Baby Can has their, in community, there's quite a few nonprofits who actually have their main offices in this zip code, and including a couple of them. So that is like incredible partnerships that exist within this community. But is there a risk that makes you think that this is going to negatively impact your work? I can tell you, when I talk to community organizations, the risk, and this has come up in my conversations with Any Baby Can, when they think about the risk, the high risk areas of the zip code, they actually think about the crime rate. And that's something I know that many of you think about when you're sending out your home visitors into the world, is you think about the crime rate within each of those communities. And this community does have a significant a significant assault rate in it. So that's something, especially when you guys are doing home visiting work and you're going into certain communities, the safety of your home visitors is something that you have to think about. And that is reflected in the safety of the communities you're going into. So thinking through what that looks like is an important aspect of how might that impact the work that you're doing? How might that impact how safe also families feel letting you into their home, and how safe your home visitors feel going into that community? I think in Austin, we're kind of like, but there are definitely places in Houston where this is a much bigger deal, and definitely places in Tarrant County where this is a really big deal. And also in Dallas, where this is also a big point of discussion, is the crime rate in that community, especially the assault rate in that community, so high that I'm concerned about sending my home visitors into the community. So those things are things that you can take into consideration when you're thinking about it. But they really help with strategic planning, but we haven't told the story of this community yet. And so that's the next thing we want to do. So SJ. So now comes the question about, well, what's the story of this community? How do you write about this community in a way that that sets the compelling stage for why you as an organization should be providing services in this community? So given what you have, there's a lot of you on this call, so I was going to do this as an open forum to talking about the story of this community. But for the sake of time, I might just tell the story of this community. One of the things that comes out, and this is where knowing the community is just as important as the data that we receive out of the community, and we can bring those two together. Is one of the stories that I want to tell about this community is home to the major injury prevention program in the city. Yet it also has one of the highest childhood injury rates. It has a high childhood injury rate. So the story I would like to tell is the story of my organization partnering with the Children's Hospital to understand how we can do better around safety, specifically in this community. So that would be one story that I would say about this community. The other story I would say about this community is beginning to have a very strong hub. And like I said, these green spaces, people use the green spaces in this community. I'm making sure that that is being taken together as an asset of a way to reach families. We have a children's museum as my organization working with the Children's Museum and the Science Museum here, is my organization working with the Children's Hospital here. So this gives a good story of community. The other story I would like to tell about this community is this is a community of two extremes. So you saw on the low income side that this is a community of really high median home prices that are increasing. And it's a story of a community that has a lot of children in poverty. So how do you reconcile those two things? And that leads to this story that this is a community that is raising that has increasing income coming into the community. Otherwise, you can't buy those houses. Increasing income coming into the community, but there is a group of families who are still being left behind with that income increase. So we still have a lot of families in this community who are in poverty and who need additional services. And then the other story I would like to tell is the need for more pediatricians in the community. With only one pediatric office, this could be one of the leading drivers for why so many children are going into the ER. As a service organization, as social service organizations for you guys, there's not a lot you can do around that. But one of the things that you can do is work with the pediatrician who is there, and maybe they can work in their organization to bring in more pediatrics into the community as well. So this becomes a story. I hope I've shown you that this becomes a story of not just saying what your data are, but saying how those data translate into a bigger story. Go ahead, Hillary.
No, I felt compelled because this is the zip code I grew up in, and my parents still live there, and they've been in their same house that I grew up in for 50 plus years.
Oh my
I
gosh.
think when you talk about the story of this community, 50 plus years ago, it looked a lot different. And,
yes.
and you think about the proximity to, now they have, before there wasn't really a highway or double-decker highway that, created even more, I think, challenges within the community, just when you think about the environmental, the pollution, all of that, and unhoused individuals and families that, created homes in the creek area that back up to single family homes. So, there's a lot, there's a rich history there that, when you think about the story of the community that also, ties back to the past and even before my parents lived there.
Yeah.
So anyway, just wanted to mention that because I felt compelled as you live in that community. That's the community I grew up in.
Yeah, I thank you for bringing that up because I try to leave that story out. This is a hugely changed community. So this new development, so to finish the story of this community, this new development that's in here used to be the city's airport. And when they closed the airport, the city still owned the land. So a whole new housing, it makes you realize how huge airports are when you look at how many houses got built in this community, and they're still building houses on the airport. This community, up until, when did I move in? 5-6 years ago. That's when they opened the HEB. This community used to not have this entire zip code did not have a grocery store until 7 years ago. So Mueller is part of this community. Yes. It's Mueller, Windsor Park. For those of you who know the area, it's Mueller, Windsor Park, Colorado Hills and Coronado Hills and University Hills. And also the other side that goes to all the way to MLK. I forget what everybody's calling that part of the neighborhood. This community didn't even have a grocery store until 7 years ago. So and now it has a wonderful grocery store, big, huge, HEB's first LEED certified grocery store, actually. So it's an interesting place, and because it's a story of change in this community. And what I'm trying to do by telling you that, for those of us who know this zip code, is this leads to a bigger thing for all of you. Is there's an important part of just when you do your needs assessments to go into those high-risk communities and just look at them. To talk to people, and many of you are doing that already, is you're talking to your clients, you're talking to the people who are walking into the door. But it's also important to go and talk to people who are just wandering around in the community as well, because many of them have been there for many, many years, and they can tell you like things. I know old Windsor Park people who have owned their homes since the airport was there, and the stories they tell me are pretty incredible. Same with University Hills. The stories they say are just incredible about when the airport was there and everything that changed after the airport was closed. So it's so the thing I would like to say with this is, when you're putting together your story, these data help you ask questions of the community. The other thing that you can do is you can take these data and you can actually present them to the community. This happened in this community, where the data were actually shown to Mueller residents, who are the Mueller neighborhood has a lot of residents. I don't want to say it's completely really high income residents, because they do a great job in making sure that housing is affordable, and a certain amount of housing is affordable. But they're really, really educated. I mean, my doctor lives in this neighborhood. Like, this is where really, really educated people are living. But taking those data to them and showing them, this is what the data look like, this is what your zip code is, and asking them about it, and asking the people in the old parts of the community what that data means to them. I would highly recommend you guys do that. This really lets the community tell you the story that is associated with those data. Are there other thoughts or questions? So I don't want to, I know Carrie has policy stuff to talk about and other things to talk about, so I don't want to take up too much time. This is the website for the maltreatment risk, for the maltreatment risk maps. The current risk maps have data up to 2019. I will tell you that there have been changes, but not too many. So for a lot of communities, the data that are in there are reflective of current data. We're working with FSS to figure out when we can release new data to you. But if you have any additional questions, my door is always open. My email is always opened. And this is my email at dorothy.j.mandel@UTH TMC. And I'm happy to talk to any of you, or to help you out, or to even like walk through what strategic planning might look like in your community as you prepare. So if there's any other questions, just like I said, reach out. I'm happy to answer any questions I can. All right. Cool.
That was such an amazing presentation, Dr. Mandel, even for myself. Thank you so much for coming in and talking to us. I'm pretty sure our partners gained a lot of information from your presentation. I know I did. Just a reminder to everybody, the presentation will be available, the slides will be available to you through our research report. Anything that is displayed on here will be available through our research report. Let me go ahead and continue with. Okay. Okay, next we will have our very own Carrie Judy's, our policy director, giving us some advocacy updates.
Hey y'all. So yeah, I'm also coming to you guys from Portland, where the weather's not all that different from Austin, but definitely a different view. I just wanted to give y'all some quick updates, not gonna give y'all too much today. But you know, obviously our regular session had ended. You guys, I know a lot of y'all have been tuned into our virtual series on what happened at the Capitol. And you guys know, because we've been talking about it a lot, about coming out to different communities and talking about how the different changes at the Capitol are impacting community and getting you guys y'all's feedback. But what we are seeing right now, just so you guys know, and I'm sure if you guys just turn on a TV, look at social media, you know there is stuff going on with the legislature here in Texas. So the governor did call a special session, and it actually began on July 21st. Just so you guys know, each special session can last up to 30 days. It doesn't have to take the full 30 days. And ultimately, initially, the governor had kind of put just like a handful of things on the call. But after the 4th of July floods, we saw a lot more, added to the call regarding disaster response and things like that. And so, what you're seeing on your screen here, this is not all of the things that are on the call, but just the major ones that I'm sure you guys are hearing about. One of the big things, again, with disaster response and communication. One thing just to tell you guys about this one, I think we'll see kind of how this shakes out. You guys have heard us talking about 211 and how that connects families to resources. Well, we also know some other states, they leverage 211 with their disaster response. So I know our friends over at United Way have been continuing to elevate 211 in that way. So, we'll just kind of see what comes out of that. They're also taking up property taxes. We know that the big the THC bill had been vetoed, so they're retaking that up. And then taxpayer funded lobbying. And then the big thing that's, like I said, if you open up your social media or turn on the news, you guys are hearing about the several Democrats that had left the state to break quorum because Texas, part of what we have on this special session call is congressional redistricting. And so you've seen the news about how so many have left the state just so that they cannot get this legislation passed. But that is also, without them here, they're not able to move anything really all the way through the process. And literally as of today, we saw, again, we know a lot of things happen through tweets nowadays, but we did see where the governor said, okay, if you guys aren't back by this Friday, basically, we're saying that once this special session ends, we're going to start a second one. So we're just seeing a lot of that going back and forth. But, I assume we will see similar things on the second special session call, but we'll definitely keep you guys posted. SJ, if you can go ahead and go to the next slide here. The next big thing that I really want to talk to you guys about is sunset. I think different folks on this call probably have heard about the sunset process. There may be some of you saying, Carrie, what is that? So in Texas, we have a really neat process where all state agencies go through essentially this process to make sure that they're running efficiently, making sure that there's not redundancies in how they're doing things, making sure that they're fulfilling their charge and their mission to the people of Texas. And so typically every agency comes up somewhere in 12 years. Sometimes they're reviewed more frequently than that, but at least once every 12 years. And they're actually written into statute that if the statute's not updated within that amount of time, then they'll sunset the agency. Now, I tell you all this not to say that anybody needs to be worried about agencies going away willy-nilly or anything like that. It's just part of this process, and different agencies go through the sunset process in different cycles. So for instance, this past cycle and going into legislative session, one of the big ones was the criminal justice, so the Texas Department of Criminal Justice. This next one, though, this one's actually going to impact and take into consideration a lot of the agencies that all of you work with. So you've got our HHSC that's coming up, Texas Department of State Health Services, so DSHS, DFPS is on this, Texas Workforce Commission, which also has childcare, and then of course the Juvenile Justice Department, so TJJD. And so this is, to me, the sunset process is a really great opportunity for advocacy. I mean, you often hear us talking about advocacy as it relates to session or special sessions, but this is something that happens during the interim and builds up towards next session. So it's another built-in opportunity for folks to be able to elevate to lawmakers and to sunset staff ways that we can ensure that our state agencies are working more effectively for the families that they're serving and the families that you guys are serving. So just stay tuned with us, because there's different things that happen during this process. For instance, next month, so September, we will start seeing some of the self-evaluation reports from state agencies. And so we'll be putting out some thoughts about, based on that information, different recommendations. We'll also, as we're going out to communities, we want to know from you guys, again, what's working well, what isn't? Are there ways that we can streamline things? What does that need to look like to better align our state agencies? Again, it's all better for families, right? That's what our aim is. And so, and we'll also be talking to you guys about ways that you guys can engage, because after some of these evaluations, there's ways to influence recommendations coming out of sunset staff to the legislature. And so that is where you guys come in, because again, you guys are the ones that know what isn't working, and you guys have the solutions. You guys know, hey, this needs to be fixed, or this could be done better. So again, we'll be looking to you guys a lot for what that needs to look like, and that will obviously shape our advocacy. And again, we would, as always, I would love for everyone to come alongside me and advocate in different avenues. So again, so just stay tuned, because again, this is just another opportunity for us to advocate, to strengthen families, make sure families are getting connected to resources and all of those things. All right, I think that's all I've got for you guys. But again, it's a really big, stay tuned. There's a lot of opportunities coming up in the near future.
Thank you, Carrie, for providing us the updates and giving us some information about Sunset. So I am going to go over really quick. Our future TPN meeting dates are going to be for October 14th and December 9th. For some reason, if I know sometimes emails get lost or calendar invites get lost, but if for some reason you do not have the future links or to the Zoom, you can just go ahead and send me an email and I can share that with you. So also coming up, we have our summer learning session on August 20th. That is a great session that is going to be coming up. So you do not want to miss that. You can go ahead and still register for it. And then ultimately, I do want to invite you guys out. For anyone who has heard about the Partners in Prevention Conference coming up in November, we are going to be having a Texas Prevention Network in-person networking event. Details are still to come. We're planning it for one of those nights so everyone can come out, mingle with one another, have that in-person networking. I know we see each other through Zoom meetings and everyone's doing awesome work out there. So it's a perfect time to come in, network with each other, and, make a new friend and outside of the Zoom squares. So that is one thing that we did want to come and let you guys know about, and we'll keep you updated on that. And most importantly, thank you guys for joining us for another TPN meeting. I appreciate your time coming in and hearing what we have to offer for you. Again, everything that we discussed, anything that we present is going to be available to you guys through our research report. If you have any questions, feel free to reach out to me through email. I am open at any time to be speaking to you, any questions, anything at all. Even if you just want to say hi, my email is open to you. Does anyone have any questions before we wrap up? Let me check. No? Okay. So I hope everyone has a wonderful rest of your week, and thank you so much.
Thank you.